Good morning. My name is Mary King, and I'm the Executive Director of the Michigan Center for Youth Justice. I'd like to welcome you this morning to our webinar on COVID-19 and the youth justice system in Michigan. And I'm going to turn it over now to our host, our Policy Director, Jason Smith. Good morning, Jason.
Good morning, and thank you everybody for participating today. I will serve as the moderator for our virtual town hall. I really appreciate your attendance, especially with everything that's going on in our society. Right now is a really good opportunity to not just discuss the juvenile justice system's response to COVID, but also really take a real look at our juvenile justice system overall and in ways in which we can ensure that it's fair and effective for youth and families who are involved with it, how we can reduce confinement, but then also address racial disparities in the justice system, which is a really important topic right now for discussion. So before I introduce the panelists and let them take over the reins, I just wanted to give a quick overview of why a statewide response to reducing the risk of spreading the coronavirus within the juvenile justice population, and specifically for youth housed in congregate care facilities, was necessary. So just like adult jails and prisons, nursing homes, college dorms, and other communal living situations, juvenile justice facilities, such as detention centers and residential treatment programs, are environments where the coronavirus can spread quickly. It is more difficult for youth confined in facilities to practice the safety precautions necessary to reduce the risk of spreading the virus, kind of like social distancing or frequent hand washing. And youth with pre-existing conditions such as asthma, diabetes, or other chronic or serious illnesses put them at higher risk for contracting the virus and makes them particularly vulnerable. So to address this concern, Governor Whitmer, the Michigan Supreme Court, and the Michigan Department of Health and Human Services issued executive orders and guidances that encouraged local courts to consider ways that they could safely reduce the number of youth in facilities by accelerating releases and reducing new admissions. And because our system is a county-based, or the juvenile justice system, a county-based decentralized system, the best way to try to better understand how local courts were responding to this public health crisis and the recommendations coming from the state level was to ask them directly. So my organization, the Michigan Center for Youth Justice, in collaboration with the Wayne State University Center for Behavioral Health and Justice, surveyed juvenile courts and facility staff representing areas across the state, urban, rural, suburban counties, to hear about the strategies they employed. So I'm going to let the panelists go into more detail about those strategies, but quickly, just the survey findings that we included in a recently released report that you can find on the MCYJ website and also the website for the Center for Behavioral Health and Justice indicates that many juvenile courts had already began working to reduce their confined youth population even before receiving guidance at the state level. And their existing and newly implemented practices led to fast and dramatic reduction of youth, the number of youth in facilities, particularly in detention centers. Our survey results were only a point in time snapshot, but it showed that early in the pandemic, there were efforts already underway to protect the health and well-being of youth under juvenile court supervision. So, okay, now introduce our panelists. First up, we'll have Supreme Court Justice Beth Clement. Justice Clement joined the Supreme Court in November of 2017, becoming the 113th justice and the 11th woman to serve on the bench. She serves as the liaison to the 188 problem-solving courts in the state, which include drug and sobriety, mental health, veterans, and other non-traditional courts. Justice Clement also serves as the court's liaison to the State Court Administrative Office, Department of Child Welfare Services, and Michigan Judicial Institute. Prior to her election to the court, Justice Clement served as Chief Legal Counsel in the executive branch, advising on a wide variety of legal, legislative, and policy matters, and she previously held positions of cabinet secretary and deputy chief of staff, as well as Deputy Legal Counsel in the Governor's Office. Today, Justice Clement will provide the Supreme Court's perspective on the juvenile justice system's response to coronavirus. Next, we'll hear from Thom Lattig, the Juvenile Court Director for the 20th Circuit Court in Ottawa County. Thom started his career at Eagle Village in 1992 and shortly thereafter as a child care worker in the Ingham County Youth Center in Lansing, Michigan. And he was a juvenile court officer, a senior court officer at the 30th Judicial Court in Lansing. Thom started working at the 20th Circuit in Ottawa County as the Casework Services Manager in July of 2019. In November of 2014, he was promoted to Assistant Director, Field Services position. And as of June 1st of this year, Thom became the Juvenile Court Director. He served as the Vice President of the Michigan Association for Family Court Administrators from 2018 to 2019 and recently assumed the position of President of that organization in January 2020. Thom will talk about the juvenile court's response to the coronavirus. And finally, we will hear from Terri Gilbert. Terri has held executive level positions in both public and private nonprofit organizations, directing programs serving vulnerable families, children, and adults. Terri is a well-respected expert in the field of juvenile justice in our state. Ms. Gilbert previously served as the Director of Child Welfare Improvement Bureau, dedicated to improving outcomes of children in the child welfare system, and as the Michigan Director of Child Welfare Funding and Juvenile Justice, supervising statewide juvenile justice programming, federal funding, and compliance for the state of Michigan. Terri was appointed by the governor to serve on the Michigan Committee for Juvenile Justice, representing practitioners involved with the juvenile justice system. She has specialized in turning around failing programs, launching new programs, and working toward a statewide juvenile justice agenda. Terri will talk about the opportunities for continuing to reduce the number of youth in confinement after the pandemic ends, and again, addressing issues of racial disparities in the justice system and making sure that our system is effective and fair overall. So before I kick it to the first panelist, a couple of housekeeping notes. For any kind of questions that you have, we're hoping to have a Q&A session after the panelists finish. Please use the Q&A box to add your questions. And then also, this webinar is being recorded and it will be shared on our social media. And I know that the Wayne State Center for Behavioral Health and Justice plans to upload it on their YouTube channel as well. So first, we'll start with Justice Clement. Take it away.
Thank you, Jason. And thank you for the opportunity to be here and represent the court system and to give an overview of what the Michigan Supreme Court and our State Court Administrative Office has been doing in response to the coronavirus pandemic. First, I want to quote our Chief Justice, Bridget McCormick, and what she has said as we've worked through how the courts respond to this pandemic. And what she has said is, this is not the disruption we wanted, but it is the disruption that we needed. We have to figure out what we can do rather than what we cannot do. And instead of focusing resources on how we retool old ways to get people back into the courthouses where all the old problems of lack of access persist, we must focus resources on bringing justice to people where they live. Our courts need a new paradigm for doing business in a COVID-19 world, one that is more efficient, more convenient, and accessible for litigants, more transparent, and less costly. So just as a general overview of what the court has done in response to this pandemic, typically we issue 2 to 3 administrative orders a year. During this crisis, the court has 14 administrative orders that have gone out that cover a wide variety of issues, including emergency measures to adjourn matters where defendants that are not in custody, those cases can be adjourned until a time where access is available, maximizing use of remote technology, and considering public health in pretrial decisions. We've also extended deadlines, expanded authority for remote work by judicial officers, delayed jury trials until at least June 22nd, extended PPOs, authorized our courts to collect contact information, and put together a plan for all of our judicial courts on how to return to full capacity. We've also partnered with the Michigan Sheriff's Association to encourage judges and jails to reduce jail populations while protecting public health and safety, and have looked at a dramatic reduction in jail populations and with the goal of preventing the spread of the virus. Specifically as it relates to juvenile justice, thanks to Mary King reaching out to me and really highlighting the need for this right at the get-go. The Supreme Court was working with our courts to ask what they were doing and what we could do in response to this. Governor Whitmer issued an executive order 2020-29 that discussed juvenile detention centers and strongly encouraged those centers to reduce the risk that the children at their facilities would be exposed to COVID-19 by implementing the following measures: removing from the general population any juveniles who have COVID-19 symptoms, eliminating any form of juvenile detention or residential facility placement for juveniles unless a determination was made that a juvenile is a substantial and immediate safety risk to others, providing written and verbal communication to all juveniles at such facilities regarding COVID-19, access to medical care and community-based support, and to the extent feasible, facilitating access to family, education, and legal counsel through electronic means, such as telephone calls or video conferencing at no cost rather than through in-person meetings. So in conjunction with that, our state court administrative office put out guidelines for our courts. What we asked is that judges work with their juvenile justice stakeholders to identify youth placed in detention residential facilities and request a risk needs assessment from the facility to determine which youth can safely return home. If release was deemed not appropriate, the probation officer was asked to prepare a petition for release. If it was deemed appropriate, the probation officer should prepare a petition for release and send notice of the hearing to be conducted by file review. The juvenile's attorney may waive that notice. The probation officer and facility were asked to work together to provide a written report recommending de-escalation or release to the judge supervising the case, the prosecutor, and the juvenile's attorney. If there was no objection to the juvenile's release, the court should evaluate the recommendation and order de-escalation and release with whatever conditions it determined appropriate. If there was an objection, the case was set for a video hearing or other remote technology as soon as possible. We also asked that if there were administrative issues in the clerk's office delaying entry of the order should be treated as entered once signed by the judge, and the juvenile can be released as soon as it was signed. And then we had some specifics of what the judge needed to do to expedite that. This really came as the result of, as I indicated, Mary King reaching out to me and sharing with me what Washtenaw County had done right at the beginning of the pandemic. And they were able to drastically reduce the amount of juveniles that were in detention. And as she raised it with me, I reached out to some of our judges that I knew were sensitive to this and would be open to it. The good news is, although we put out these guidelines, what I heard from around the state is that we had judges and juvenile justice stakeholders that had already started this process. They might have been doing it a little bit differently, but they were absolutely aware of the concern and the risk to our juveniles. And they were already, in a number of places, they were already doing it. In some places, we had issues with appropriate technology or having all of the various stakeholders working together. And I think that the guidelines that we set forth really helped our courts understand the need to do this, as well as give them the tools to make this possible. And we know that there was a drastic reduction in the kids that were in detention. What I think is the most important from what we learned of this is that we don't need to just do this when there is a crisis or there is a pandemic. This is something that we can learn from and take and move forward with. We should be looking at how to get the juveniles back home. I have 3 teenagers. I know how difficult it was for them to be home and to be in these very, very uncertain and often scary times. So I can't even imagine what it is like for our youth to be away from their families and to have limited contact with their families during this very traumatic time for children. So the goal was to get as many juveniles back into the community as possible, get those resources available. And what I'd like to see from the court side is for us to continue this. Another positive that we saw from this situation was our youth are very comfortable with remote technology, much more comfortable than adults are. And where we had to do a lot of training for judges or court staff, what we heard, and at first it was anecdotal, and now I would say that I've heard so many stories that I no longer think it's anecdotal. I think that we can really take the stories that we've heard and realize that it's happening across the state. And that is, we've had a lot of court personnel that have had a lot of difficulty interacting with our youth at in-person hearings, where they're reluctant to talk, they're reluctant to share what they're feeling, what they're going through. And I've heard so many stories of just a youth being able to be on a phone and Zoom into these and have conversations, whether it's with their lawyer, whether it's with the court. They have a sense of ease and they're opening up more. So I really think that this is something that we need to learn from, and we need to realize that the court setting is probably scary for our youth. And how do we address that? And how do we adjust to think of their needs and still accomplish what we need to be doing in our court hearings, but do it in a way where they're in a place where they feel comfortable opening up and sharing what's going on. I'd like to say that I'm very proud of our judges and all of the stakeholders that are involved in juvenile justice. I think everyone has proven that they have a passion for our children. They have a passion for improving our system. And I think that this is an opportunity to learn from what we know hasn't been working and what we've been able to accomplish in a very short period of time, because frankly, we were forced to. We were forced to do something different. And I think we should take that opportunity and escalate that and imagine what our system could look like and how we can help our juveniles that are interacting with the juvenile justice system. As Jason indicated, I also serve as a liaison to child welfare, and I have extensive experience and interaction with the adult system as well. We all know that children that are going into child welfare system often end up in our juvenile justice system, and those same children end up in our adult system. We have to look at the entire system of justice and make sure that we are helping our kids at the youngest ages, and then if they are in the juvenile system, that we are identifying all of the resources that we need to assist them to stop this cycle. And I'm very proud of all of the individuals that are involved in juvenile justice and are committed to this. I think that the Michigan, the Governor's Committee on Juvenile Justice, which Terri is a member of, and we have a new chair, Bob Higgins, they are really committed to taking this opportunity and saying, how do we turn this into something where we can improve our system? So I think we're heading in the right direction, and I don't want the difficulty of not being able to get together and meet and have these discussions to stand in our way. I think we can continue working on all of this and really focus on what we need to be doing to help our children. So thank you for the opportunity to share what the court is doing. And as Jason indicated, I'm happy to answer any questions you have after Terri and Thom are done presenting.
Thank you, Justice Clement. That was great. Okay, Thom is up next, Thom Lattig, to talk about the juvenile court's response. Thom.
Good morning, everyone. I hope everyone is doing well today. First of all, thank you to the Michigan Center for Youth Justice for putting together this virtual town hall so we could share a space to talk about the impact COVID-19 is having on our youth and staff and our processes in juvenile justice. So thank you, Mary, Jason, and the entire MCYJ team. I'm also honored to sit with such a distinguished panel of not only experts in their respective fields of the courts and advocacy, but also people who passionately care about our youth in the juvenile justice system. As president of the Michigan Association for Family Court Administration, commonly known as MAFCA, it is my honor to represent juvenile court across the state of Michigan. MAFCA has represented juvenile courts across Michigan since the mid-70s, with its core purpose being to promote proper standards of care for our youth, efficiencies and effectiveness in our court process to benefit our clients, and working collaboratively with stakeholders across the state and country. Juvenile courts have subscribed to the idea it takes a village to raise a child, so we all must work together to improve the lives of our youth. As you can see in the article, we had a fairly good turnout of people who were able to share their thoughts and constructive feedback about what was happening at the time COVID entered our courts. As Jason mentioned, on June 1st, I was honored to be named the Juvenile Court Director here in Ottawa County and feel humbled to be part of a local court system who has dedicated itself to establishing and adhering to our mission statement across our circuit and probate court to administer justice and restore wholeness in a manner that inspires public trust. Our court works on that daily, and annually we strategically plan around these goals and objectives so that our everyday activity in our courtrooms and in our community is aligned with our mission and vision. Certainly the pandemic altered our delivery, but because we have a very good judicial and court administrator leadership, we as a court were able to use our strategic focus areas guided by our mission statement to redraft our objectives in order continuing our administering justice and restoring wholeness. Ottawa County and the Circuit Probate Court were able to place a thoughtful plan together that encompassed local public health guiding factors along with guidance from the Supreme Court and CDC in order to continue facilitating needed court services. Locally, our county administration, including our local health department, convened a COVID-19 response team made up of county and court department heads. Meetings happened immediately on a daily basis for long periods of time in order to best plan how our users and our employees were going to benefit or at least understand how we were going to react in this difficult time. The court and county both used employee surveys to engage the workforce in this dramatic change. Initial changes in Ottawa County included remaining opening for essential services despite the county buildings being closed. The county and court encouraged us to work remotely while still making sure that people that needed to use our services were going to be able to do so at the highest level. In other words, continue to service our community. And for the juvenile court, that especially was important because we know that often our system is misunderstood, don't know how to access the information or the services. And so the juvenile court particularly had to be constructive in its thought about how to still connect with our kids and their families. Locally, our county administrators and court administrators were able to make sure our employees were able to access their software, their computers, had access to PPE and cleaning and sanitizing supplies, so that again, that our employees were comfortable. Here in Ottawa County, we believe everybody belongs. And so belonging meant making sure not only were our employees satisfied, but our customers were going to continue to be satisfied. Our juvenile court quickly moved to remote working. We had to ensure that not only did our workers, our probation staff, our therapists had access to technology, but so did our clients. We know that our families often don't have the latest and greatest technology. So we as a juvenile court worked through our probation staff and our treatment staff to make sure that our clients were communicated on a regular basis, often 3 to 4 to 5 times a week as this got going, to make sure they understood where they were with their treatment plans, how they were going to access court services, and to make sure if there were any other needs that they need, including food and clothing, and especially their educational opportunities that needed to continue. On March 18th, per the governor's executive order, our detention facility started screening detention employees entering our facility. We increased our virtual and telephone contacts for all youth that were remaining in our facility to make sure they had that personal connection to get their needs met back home the best we could. We continue to inform our staff and residents with the latest on COVID requirements. We posted signage, we provided written information, and most important, we talked to our youth and their parents. We evaluated and reduced our census at the direction of our court administrator and chief judges immediately. Within hours, we had a reduction in our census to make sure the kids that could go home could safely go home with services still in place. We made sure any volunteers and mentors that were important to our facility were informed that unfortunately right now that wasn't going to be able to continue. We also put in a 14-day quarantine plan so that any new residents that came in on a new law violation or court order, which were minimal, were placed in quarantine but still provided medical service, access to their families, and especially services going on within the facility. On April 16th, we implemented a plan and policy requiring our detention workers to wear a mask the entire time they work for the safety of all in our facility. Healthcare services continued at a 24/7, 365-day-a-year plan as it had pre-COVID as well. We continue to hold detention hearings in person, but with the option to participate remotely, with most of our clients did. On March 23rd, all of our probation and treatment staff were able to go home and work remotely. We did this knowing we confidently could continue the high-level services that Ottawa County and the 20th Circuit Court have always demanded that we offer our clientele. We did so by using laptops and phones and making sure our staff understood how to communicate with our clientele. Our therapists were able to continue teletherapy, and our group leaders who provide pro-social activities for our kids that's meaningful to their growing within our community were able to continue virtual community service and virtual surveillance. So our programming, community-based and in detention, was able to continue at the high level we expected. And we also were able to work within our detention facility and our Juvenile Justice Institute, which is our community-based school operated by the court in collaboration with our local ISD, was able to quickly transition to online learning so that kids can continue to get their education. As president of MAFCA, I was able to talk with many juvenile courts across the state to see how each was continuing to operate. As you can see by the article, juvenile courts were offered guidance and support in order to facilitate this massive change that was unfolding in our courts, while still trying to maintain the restoration, rehabilitation, and accountability factors juvenile courts have historically provided to clients and communities. In an effort to support one another and share information, MAFCA offered 2 virtual roundtable discussions throughout the first 6 weeks. These roundtables were used to discuss not only things that were contained within this article, but also how we were going to strategize and employ best practices in this most difficult time without relying on just ourselves to do it, but to reach across our different jurisdictions to support and guide one another in an effort to continue to offer the high-level services juvenile courts have traditionally done. As you can see by the article, detention facilities quickly evaluated their local census in their facility. Within hours and days, our census reduced under 50% in most of our jurisdictions. As of today, I know that most of our juvenile detention facilities that are court operated still operate at less than 50% capacity. And that is as a report as last week in a MAFCA call I had, and only permitting intakes for the most serious new law violations. As it was in Ottawa County, most of our partners were able to continue educational and therapeutic services virtually. And where possible in detention facilities, not only did they reduce their sentences, but they too also increased virtual opportunities for kids to have more frequent contact with those that they're close to. Parents, grandparents, aunts, uncles, siblings, all people that were necessary to continue the care of our kids in care. For those juveniles that were violating court orders, we as a collective group across the state asked of our staff to be creative, as they always have, to use electronic monitoring where possible, and most importantly, work within the structure of the home to offer accountability, apology letters, book reports, household chores, restrictions on video equipment, etc. Youth who were placed in out-of-home residential care had their cases reviewed formally on the record and informally with assigned judges and court administrators to see if there were alternatives to keeping youth placed out of home safe. And most importantly, could they be returned home? As reported in the article, of the reporting jurisdictions, which I think were around 13, we know of 3, if not more, that were able to reduce those typical long-term care facilities to under 50% as well. In some jurisdictions, court services continued virtually, as I mentioned, both in community service, education, therapy, and other pro-social activities that we know our kids need. And most importantly, we understood that financial strains were happening on our families at a greater rate than they were before. So reimbursement requirements were also relaxed and or suspended. We have learned valuable lessons during COVID-19 that can have lasting positive impacts on our courts and most importantly, our youth. And we know there are challenges yet to overcome, but because we have a thoughtful judicial leadership group, both at the Supreme Court level and our local courts, and our court administration, we are confident we can continue to administer justice and restore wholeness in a manner that inspires public trust. Thank you.
Thank you so much, Thom, for the overview of both the local response at the Ottawa County Juvenile Court, but then also giving a great overview of what other courts around the state did as well. So finally, we have Terri Gilbert to talk about the opportunities for continued reform, even after the pandemic ends. Terri?
Thanks, Jason. First, I'd like to give a shout out to all of our colleagues at the detention centers and the circuit and probate courts for answering our phone calls and answering our surveys. We really appreciate it. I know, as one person said to me, Terri, are you kidding? I'm right in the middle of figuring out how to screen 3 shifts of staff and 20 kids, and you want me to answer your survey. So I was able to convince my colleague that it would be really helpful and important for us going forward if we understood from them what they were doing in their facility. So thank you. My colleague and I, Bianca Birch, reached out to you and you responded, and we really appreciate that. We live right now in extraordinary times. Those extraordinary times are presenting us with an unprecedented opportunity to examine not only detention and residential facilities, but our entire juvenile justice system. As Justice Clement commented, oftentimes youth in the juvenile justice system had contact with the child welfare system. Indeed, we know that 50.5% of youth who were formally adjudicated had some contact with Child Protective Services and or the child welfare system. The Child and Adolescent Data Lab at the University of Michigan did a study on this and found that it was, in general, 8 years prior to their juvenile justice involvement that a youth had contact with the child welfare system. So as we look at our systems, this is the time to really consider systemic reform. We need to look at structural racism in juvenile justice and also in child welfare. We need to look at overrepresentation of children of color in both systems. And this is the time that we should be able to do that. Rather than fix a program or fix an intervention, let's really take this opportunity to fix a system, to really examine it. So that's my little soapbox lecture for today. But in terms of the opportunities that we found, when we launched this report, we were dealing with what we thought was a very big crisis in COVID-19, we have now been able to layer onto that the opportunity to look at equity in the justice system. The opportunities that we found arising from the COVID situation also apply to our unprecedented look at structural racism. So I hope we can expand our scope as we move forward. So what were the opportunities we found when we interviewed all of these court administrators and detention system administrators? One was, as Thom mentioned, we reduced our length of stay in detention and in residential services, and indeed we reduced admissions to detention centers to a very large extent. Nationwide, detention center populations are down 50.4%. I think we found even more than that here in the state of Michigan. So the opportunity for us now is to really examine who do we detain and why do we detain those youth that we do detain. For those youth who were released or who were not detained, are we going to follow them? Are we going to look and see what was the impact here? Did crime increase? Yes, no. Did these kids go out and commit additional offenses? Yes, no. That's going to really tell us about what we should be doing with our detention population. Does everybody who was previously detained need to be detained? For youth who violated probation, do they need to be detained as a punishment for violating probation? Or are there other responses that are just as effective? Those are the kinds of things that we want to look at in terms of detention and residential length of stay. I think we need to really look at the data short-term and long-term. What was the impact of these kids who never came into detention? Was there one? Was it serious? Is it a large impact? We need to be able to track that, which speaks to the fact that we do not have good juvenile justice data. We couldn't answer the question of how many kids were in detention and how many kids were released without having to go one-to-one to each facility to call and say, how many kids did you have yesterday? Who are you letting go? How many are you left with? So in order to be able to use this moment as an opportunity for change, we have to examine what we did and what the impact was, short-term and long-term. I don't know how we're going to do that. Individual courts have the opportunity to do that. As a state, we don't have this opportunity because we don't have consolidated data. But if individual courts can track, these were the kids that we decided not to detain, these were the kids we released, and here's what happened to them. This many were rearrested, this many were not rearrested, this many reoffended. If you as a court keep track of what happened, you have information to contribute to who in the future should be detained and who really doesn't need to be detained. So that's sort of the front end of your system and looking at systemic change. That then speaks to the application of technology. Before I get there, I want to mention one more thing about detention. Oftentimes there are youth in detention who can't go home for various reasons. And it may not be because of the offense they committed. It may be because their family lacks resources or their family simply doesn't want them back. Sometimes that happens. The family's like, you know, you have been so much trouble to me. I don't want you to return home. So I'm not going to come and pick you up. Or if I do pick you up, I'm just going to let you run the streets because you're a real pain. And we know that teenagers can be that way. So what kinds of services can we develop in the community to help kids who really can't return home safely? Detention's not the answer for those kids. It needs to be something else in the community. Is it an independent living service? Is it specialized foster care? Some way to get those kids into a community setting where they can be sustained and where they can thrive. So let's think about technology. Oftentimes we employ technology during a crisis or we use what we already know. But there are a couple of different situations here in which we could effectively employ technology. It was unprecedented for the courts to hold a video conference hearing, right? And we've done it and it has worked. And as Justice Clement commented, it allowed for additional access to a court hearing on behalf of children and families. what else can we do with technology? People had to learn quickly how to monitor their kids in the community so that a kid on probation or in a diversion program was consistently monitored. And people had to think fast about, how am I going to monitor somebody? Oh, if they have a smartphone, we can do this or that. But this gives us the opportunity to leverage technology to better serve kids in the juvenile justice system. And when we think about leveraging technology, I'm sure there are a number of things that our technology partners could think of that we've never implemented but could be implemented effectively. So often tech does not pair with child welfare or juvenile justice because we're not seen as savvy, cool, and well-funded. But this is exactly where the meaningful leveraging of technology could make a huge difference to everyone. So I challenge people to go find a tech partner who's willing to be creative with them and come up with new ways to both track and monitor kids in the community or to provide technology to families so they can better participate in telehealth, in teletherapy, and in their court hearings. So that was something else we saw employed extensively, in that detention and residential facilities employed technology to access healthcare for youth in the facility and to access therapeutic interventions. Now we know, and we've heard a lot in the media, that people have accessed mental health services via technology that normally would not have accessed mental health services. They either can't access the services, they don't want to drive to an office for a therapy appointment, and doing it online has provided additional access for people, also for people for whom accessing mental health services is not acceptable. It's not acceptable personally or culturally or within their family unit. They can access mental health services via technology without really having to disclose it to everyone. So there are lots of reasons why people were able to access telemental health at an increased level. One of the most disturbing things that we found was some facilities who lost their access to educational services because they did not have online educational access. One would think that your education is a universal right and something that we provide to every child. That means that we need to be prepared. The educational system needs to be prepared to deliver virtual educational opportunities to youth and do so via technology so that youth in facilities have access to it, but also youth at home have access to educational interventions. One of the other things we looked at is consistent planning for youth. A couple of colleagues of mine who read our report said, well, those are obvious recommendations. Maybe they're obvious recommendations, but they're not consistent across the state. So for a system that engages in very good reentry planning and starts, days, months before a youth is to be released, congratulations, that is fantastic, but everybody doesn't do that. They don't have the capability in terms of staffing or in terms of program opportunities, but indeed, that's something that results in the best outcomes for the youth once they hit the community, which then cycles right back to expanding community opportunities. Thom talked about bringing all of the systems together to work well for the youth. Absolutely, this is our opportunity to make systemic change, and that is multidisciplinary, and that is bringing everyone together that touches a youth justice kid, and there are many people that touch that kid, to coordinate services and to make the services available in the community that work for the youth and families that are in the community. Finally, we talked about the ability to implement statewide data reporting and analysis. This again raises the issue that many of us have talked about for years, in that we need to be able to track and trend our data so that we know what's happening in the system. This is absolutely the right time to begin to track the data. Who was detained? Who wasn't detained? Was the decision made on who to detain, who not to detain? Who was released early from a residential treatment program, and what happened to them? Once we know those results, we can make more informed decisions up front about how we serve kids in the juvenile justice system. But our lack of coordinated statewide data is going to impede our ability to do that as a state. And so that's going to make systemic reform challenging, but that doesn't mean we shouldn't try to do it. So that's our last tech enabler. How many courts have appropriate case management software, have ability in terms of their staffing to be able to do data entry, data analysis, and tracking of outcomes? We are a state that does not know how many kids are in the juvenile justice system, where they went, what happened to them, or what we pay for this system. This is the opportunity to change that right now. That's my challenge. Thanks.
Thank you, Terri. And I also want to give a shout out to the people who answered my calls too during the survey. We really appreciate that. Okay, so we have a little less than 10 minutes for questions. We have several questions coming in. I wanted to give the first question to Justice Clement. Judge, what lessons were learned from the implementation of remote court functions that may influence how courts operate in the future?
Well, I think the thing that we saw primarily in getting feedback from our courts was lack of technology, either on the court side, lack of technology for attorneys, but more importantly for families. And as Thom indicated, they struggled with that in Ottawa County, and they had to work hard to figure out how to get that technology to the families so that we could improve communication. And I think that's going to be a continuing concern. I think it's something that my hope is that we continue remote hearings, because I think that what we'll see, and I agree with Terri that we really need to focus on data and collecting data. But what I think we will see is that an increase in connections remotely, whether that's with a youth and their family, or a youth and their attorney, or the probation officer, or the court, is going to result in the youth possibly moving through the system faster, getting back home faster, or getting off of probation faster because there's more frequent connections. But I do think that we're going to have a continued need to improve technology with all the various individuals that are involved to help the youth.
Thank you. This next question is for Terri, but Thom, you could feel free to weigh in on this too, because I think you might have some insight. It says, I agree with Ms. Gilbert. It is time for real systemic change on a structural level, having worked with the juvenile justice population previously, as well as teens in general. This is a prime group to tackle, as they are the most amenable to learning and training. So instead of eating the elephant in one bite, so to speak, what is it at the tip of the iceberg to rectify that will have a domino effect to produce a scaled remediation for this system? I guess that's what the first step should be.
Well, that's the $64,000 question, and that's a great question. I think that one of the first things we need to do is find out what our system looks like right now. In terms of mapping the resources that are available. Because the juvenile justice system is county-based, we need to have sort of a central compendium of who's in the system, where they go, what are the resources available, so that we can minimally begin to equalize those across the state. That might be the place to start. I think that any group of people would be very open to suggestions from the community, from parents, from youth, from everyone who touches these kids, child welfare, juvenile justice, the courts, the counties themselves. We pay for these youth up front and potentially for a long time. Why don't we reinvest that money in reforming the system and preventing involvement? Thom, what's your suggestion?
I think it's multi-layered. I think first and foremost, we need to quit working in silos. We have many great agencies across the state willing to talk about this subject matter, but often we talk about it separately from one another. We have, you know, obviously leadership from the Supreme Court down to our local courts is extremely helpful, but at the grassroots level, we have folks like Vision 2020, MAPCA, the Michigan Juvenile Detention Association, the Federation of Residential Placements, on and on, that work in separation of each other sometimes for the greater good of the kids that we're working with. And we need to work more collaboratively together with a unified voice and a purpose that actually serves the interests of our kids and their families and not our own. Certainly we lack data, and we lack a centralized system to kind of make us do it. But I think that sometimes, maybe not on the data side, that we underestimate the value of local leadership. I know locally, our Chief Judge Van Allsburg and Chief Judge of the Probate Fine and Kevin Bowling, our court administrator, are always looking for us to be progressive and honorable and honest in what we're doing. And I don't think that's any different in local courts, and definitely what we're hearing from the Supreme Court. So really just taking the time to deliberately execute an action plan that will have meaningful and long-lasting change in the system for our youth.
Thank you. So there's two questions that really relate to funding, and I'll let whoever feels most comfortable answering this take a stab at it between the three of you, or all three of you if you want to. One question, which kind of is related to the other one. These adjustments in services to youth and family would be great to continue as courts and services move forward. Is there any state support for funding to assist with the resources necessary, such as technology to families? I remain concerned that this could add to the disparities in practice due to financial and resource issues for families. Those with poverty status may not be able to participate in technology-based hearings, for example.
I'll take a crack at the first part of that. We do have to pay concerted attention to the digital divide. We know, for instance, in Wayne County that many of the families did not have the ability to access remote court hearings, or they did not have the ability to video conference with their youth because they didn't have the equipment. And that was one instance in which the Center for Behavioral Health and Justice worked closely with the philanthropic community to try to get some funding available to provide technology access. Now, in general, that went to the adult system because the needs were also intense there. But perhaps that kind of model can be used to align the philanthropic community to engage with us in systemic change, and therefore perhaps provide some seed funding to be able to get this going.
Thom, Justice Clement?
The other thing I would say about that is it's like the challenge of funding prevention programs. It's always difficult to get funding for prevention because you can't prove that your intervention worked, but you do have correlations. So if we can figure out how much does juvenile justice actually cost us, and what is the lifetime trajectory of a youth in juvenile justice, and how much does that cost, potentially over time we can remove that cost by building a better front end, by building a better system so that we don't see people progress from child welfare to juvenile justice to adult criminal justice. And I think somebody asked in the questions if we know what that path looks like and how many people take that path. At this point in time, I don't know that. It's potentially being researched right now, but I don't have that answer.
Any other thoughts?
Jason, from my perspective in local courts, that certainly there is an issue of funding when it comes to technology. We know that access to justice should be a priority. And now that we're working more remotely and we're accessing our clients through phones and laptops, that doesn't mean that we should assume they all have one. And so having the ability to put that instrument in their hands so they can access services in court hearings is critically important to how they're going to have fair and access to the justice system. And so any kind of funding that's limited now would be appreciated, in a conversation I know has been discussed at the state level. And so hopefully we'll be able to build upon that.
Okay. One more question for Justice Clement. I know you talked about the innovative ways in which some juvenile courts have told you that they implemented the guidance from the Supreme Court. Could you give an example? Provide an example?
Yeah, absolutely. So we put out this guidance for those courts that maybe were not already doing this. But we worked with Judge Frank Szymanski from Wayne County, who really brought his plan to us. And we took that and shared that exact plan with our juvenile court judges across the state. And I know that different courts took pieces of that and had that work within what they were doing with their own maybe roadblocks or difficulties with technology. But honestly, there were a lot of counties like Ottawa that was doing this before we even put out our guidelines. Although I can say that we had a number of courts reach out to us and say, thank you for this. We needed this guidance to know exactly how to do it. Or on the flip side, to have various stakeholder groups say, it's helpful to see that you did this so that we can contact the court and contact the judge and say, we know that the State Court Administrative Office is recommending that you do this. Can you please do so? And I know that was something that that definitely happened. One other thing that I do want to touch on that I think is important, because the State Court Administrative Office and the Michigan Supreme Court has been so supportive and urging remote hearings. One of the things that has come up both in child welfare and in juvenile cases is the privacy concern. And I think that's a really important thing that we need to talk about, and that everyone that is on this webinar, anyone that's involved in juvenile justice, needs to be aware of and needs to be supportive of looking at what we need to do, not just with remote hearings, but also with in-court hearings. So we had to make sure that hearings are open to the public. It is difficult to do that in a remote platform. And then you have privacy concerns. We have a lot of people at home. We didn't want people getting on YouTube and just watching court hearings with sensitive information regarding our youth and recording that, sharing that on social media. So that was one of the big obstacles that we've had to work around. And it's my understanding that there is legislation being prepared to address privacy concerns when it comes to remote hearings, as well as hearings inside the courtroom. A judge has more control over that because they can see who's in the courtroom. They can ask, are you just a general court watcher? Or are you, interested in the specific case? It's very, very difficult to do that with remote hearings. And we heard that over and over again from our judges that were incredibly concerned that these youth and their private information would be shared. So we've had to do a lot of innovative thinking to work around that.
Thank you so much, Judge. Yes, exactly. That the issue of privacy and confidentiality for youth is an important topic right now. It's a topic statewide for both youth and adults currently in the legislature, but it's important, especially for youth, that we maintain privacy and confidentiality for those hearings, their records, as much as possible. And I applaud the Supreme Court for considering that, and then also the legislature for taking the legislation up to try to address those issues. So we've reached our time. I want to thank all of the panelists and then kick it to Mary for a farewell sign off.
All right, thank you so much to our panelists. Thank you, Jason, for being the host. And also thank you to everyone who took time out this morning to attend this webinar. We hope that you found it useful and informative, and we'd love to hear from you. We will make sure that everyone who attends gets a copy of our full report, and we'll also be sending out an evaluation. We'd like to hear from you about what you thought about the webinar, and because we're hoping to offer future webinars. Hope you have a wonderful weekend, and everyone take care. Thank you.
Thank you, Mary.
Thanks, Mary.